Hi everyone, I'm Dr. Karam, and today we're going to talk a little bit about fillers versus facelifts. Now, it seems like a pretty obvious topic and one that has two totally different places in the anti-aging continuum, but we're going to talk a little bit more about specifically when you use fillers and when you use a facelift to rejuvenate your face. But before we get launched into that topic, please take a moment to subscribe to the channel, and at the end, please remember to like it if you enjoyed it, and also to subscribe if you didn't do it before. All right, so here we go. This is the history of facial anti-aging. Years before fillers were available, the only treatment that was around was a facelift, eyelid surgery, surgical anti-aging techniques. And those were generally speaking reserved for people who were in their 60s, late 50s, mid 60s. And so as a society, we came to believe and expect that somebody would have to look really old before they would have a procedure like this. And the only option was a facelift. Now, what happened is somewhere around the mid-90s, early 2000s, there started to become an increased awareness towards non-surgical procedures. So non-surgical procedures, specifically various type of tightening procedures, fillers, etc. And because the early facelifts, the traditional facelifts, all looked so unusual looking, that made people look weird and pulled, that these non-surgical treatments seemed to be a new hope, that maybe somehow we could avoid a procedure altogether, or at the very least we could ward off aging and keep somebody from needing to have a traditional facelift and avoid that windswept and unnatural look that came with it. But what ended up happening was, after about 10 or 15 years of experience using these fillers, we began to understand two things. Number one, fillers are good for replacing lost volume, but they are not good for repositioning or lifting the face. And when we attempted to do this using very innovative and very well thought out approaches, what we found was that faces started to look weird. They started to look big and heavy, almost like an alien up top, or if we put it down along the jawline, they started looking masculine if they were a woman, and kind of horse-like and heavy along the lower face. And when you take that in combination with the fact that the face starts to slide downward with age, you start looking even worse. Heavy on the bottom, full up top, you become looking like a square or a rectangle, which is not the youthful shape. So basically where we are at now is a point in time where we have to make a decision. When do we use fillers and when do we use surgical modalities? Now, the good news is most of the surgical modalities that are available in the most cutting edge practices like ours, what you get is a very natural looking outcome. My preference and technique is a technique that I developed called the vertical restore and vertical prevent. Those procedures always leave the person looking natural and unoperated. So there's not as much of an argument for, if you have a surgical procedure, you're gonna look weird if you have the right procedure. But now the question becomes, what do you do when you're in your 30s and 40s and you start to see laxity in your face? Is that too early to have a procedure done? Or should you be going down the non-surgical route with fillers, etc.? I believe we're at a very interesting junction in time where the individual has a choice between going to this approach or the filler approach, the surgical or the filler approach. My argument would be, and has been for several years, is if you have laxity in the face, if you start to see your jawline creeping down, you start to see the mid face coming down and deepening the nasolabial fold, or even any kind of laxity in the neck, and you think that you might want to try to improve this with fillers, you're gonna be met with disappointment. There's no way that that'll correct those problems. Truly, the only way to address it is to move forward with a surgical vertically repositioning procedures such as the vertical restore, or some other type of procedures that have the same generalized characteristics. That's a big paradigm shift for a lot of people who have always thought that those procedures should be reserved for when you're older and the non-surgical procedures should be reserved for when you're younger. Now the reality is we're starting to see a massive shift where the patients who are coming in are younger in the aging spectrum with actual aging changes that would justify a surgical repositioning procedure. And those patients are bypassing fillers altogether. They're not wasting their time and money with those procedures, and they're getting much more successful outcomes because of it. So in summary, my take-home message here for you would be, if you are seeing generalized volume loss, you need to treat that with volume, things like fillers or fat transfer. If you see sagging components in your face, and you'll always know that because you'll lift up your face and you're like, oh, that takes care of all the things that are bothering me. If that is the assessment, then you need to have a surgical procedure and prevent yourself from going down a road of disappointment, cost, and ineffective procedures. Big sort of shift, I think, is coming down the pipeline. I believe in the future this will not seem like such a controversial or interesting topic, but for right now, it definitely gives us an opportunity to pause and think about the logic and the sense of these two approaches for laxity-related aging changes. I hope that was informative and helpful for you and eye-opening. And please feel free to comment and add any questions below. We have lots of videos on these topics as well as on our Instagram at the same handle. Please don't forget to like and subscribe to the channel and share this with people who you think would find this topic interesting.